also pacemaker precautions are a variation of that. It's a shorter amount of time. So I include new pacemaker as well. And mainly they are not supposed to lift higher than 90 degrees. They're not supposed to bring both arms out at the same time. They can do one at a time, but not both. Not supposed to extend the chest out like that. They're not supposed to do any pushing or pulling with their arms. Okay? So when they dress,
Therapy in the square.
therapy in the square. They keep it in the square. All right. So when they dress, they're going to.
Almost like the cervical patient.
Yeah. They're going to do
Almost
this
exactly.
and this. Again, bigger is better when it comes to shirts.
Yeah, no tight. I
And
tell
then
them
instead, unlike the cervical that does it straight up, they're going to tuck like that down, so they just sneak it over the head. Right? Now they can't reach around their back to do it, so you do cross arm technique. So this arm goes this side,
Just
this arm
scratching
goes
their back.
this side. And you get down, get down.
This is usually where people cheat. They'll go.
But see, as long as they're
this.
crossing their arms this way and not doing this.
Right.
Okay. So you're crossing your arm and using one over the other, then you're actually compressing the fracture area rather than expanding it. So they can reach to the sides of their body here, but they shouldn't reach back yet.
So they can go midline, but they cannot go.
They can go right to the left, yeah.
Okay.
Yeah, and they can go across.
They're literally in a
Okay, now with
Yeah.
pants,
Like even if you're wiping your bottom, if you come down here, you're
Okay.
fine. If you come out here, you're not. So we say literally keep your hands in and down one side working at a time.
now with
Yeah.
pants, external precaution can use a cross leg technique, but they're not supposed to lift. And I had a patient that did this. So that's why I started using the reacher with her, because she was lifting her legs literally with her arms because she was so weak in her legs from.
Or they might have oh yes, I know. Or you might have staples or sutures or something where they have swelling
But
and
it,
pain
so
and
if
they
they
can't
can
get their
lift
leg
it,
there
if they can
anyway.
lift it up without using their arms to do it, they can use this technique, and then they can put it over that leg, and then put that leg down. Notice I'm not using my hands to do that like I would with a stroke patient, and then get it down low and try to get your footing. And if that doesn't work, you can use a reach or you can use a socket. You can use all of those things. And then when they stand up to pull up their pants, remember they're not supposed to reach back here. So again, you're going to pull it up the best you can from the side.
And they just get it in 6 to 8 weeks and then they tell them, go ahead, use your hands.
now you can use your hands.
Because external
Okay.
precautions are very temporary.
And then when they sit down, they have to do this and not push it up.
Now, out of habit, it's a possibility you'll go and do this. Are they gonna feel like, oh,
No.
or they might not even repeat it?
Sometimes pain will be your guide, but not always.
Not
Some
always.
people don't have any
In our
response to
hospital,
pain.
usually they'll give you a little pillow
Yeah.
to hug to remind you.
They do,
red button.
yeah.
And,
Give you a little pillow.
and always, when
And
they're
you
first
walk
learning, I
around
always
well,
have them hug their
That
pillow.
like the best
After
way.
they get good at it, then I'll tell them just cross their arms over the chest. But yes, you do a lot in the treatment.
Hug your buddy, hug your buddy, hug your buddy, alternating hands. You make it a dance move or something because it is hard. It's automatic. It's habitual.
Yeah.
They'll want to reach
Yeah.
back and grab even with wiping or
Well,
pulling their
and
pants
not
up.
only
It's like,
that, they're so weak because they've lost so much endurance. That's why they end up in rehab. They can't get out of a chair without using their hands. So we start them really high up, getting up, and work them down slowly. And yeah, some of them don't get very low, and we have to make sure everything's elevated. when they go
right, the
home.
bed's elevated. But
The chair's
just know
elevated,
right
the
now
bed's
the
elevated.
biggest thing is the ortho knee. Be aggressive, weight bearing is tolerated. Like she said,
Okay, see
hip,
my cross
you're
arms?
either going to see min or mod. So either we'll be min where you can have us sitting in the chair, or we'll be max where you're going to just roll and get the pants up or do a bridge. Okay, so if we were in bed with the knee, you could have them just lift and bridge in bed and try to get the pants up. Shirt on the orthopedics, knee and hip is going to be 2
Yeah.
seconds. You can put your shirt on however you want. You just got to
Well,
make sure
yeah.
they do lower body correctly.
And with knee patients, if they're a typical knee replacement patient, they can probably do it without equipment, but I check it out. If they've got any kind of brace that they're not supposed to bend their knee, then they're gonna need equipment too. And the socket doesn't work if you have a Bledsoe brace that goes down here to the ankle, by the way, so they need a little help with their socks usually, because the socket can't go over it. Yeah, a typical knee replacement patient, of which I was one for both knees, can get down to their feet. It's just a little bit of work because I had to do it like this. Because I couldn't do it like this.
Okay.
But, yeah, so, I get occasional evaluations for those patients. I have one doctor that really likes OT for some reason, and I go in there and say, okay, you know, you put on your socks.